Exercise Unit 9. Complete the table with words from A, B, and C opposite. Put a safe make in front of the same syllable of each word. The first one has been done for you. Bears none. Admit, admonition. Anxious, arguments. Desire, desire. Operate, operation. Refer, referral. Tears, tratamiento. Make word combination using a word from each book. Look at C opposite to help you. Acutely ill, estimate unit, one day, refer letter, within list. With hospital department will be most opposite for the following patient. Look at A, B, and C opposite to help you. A woman in diabetes come. The answer is intensive care unit. A patient who has just had a radical prostatectomy. The answer is Heme dependency unit. A patient who used to have a clean lesion renoved. The answer is the surgeon unit. A man with a foreign body is this eyes. The answer is gynecology emerging. A woman with addition needs abortion. The answer is accident emerging. Complete the extra from an information letter for patient. Look at A, B, and C opposite to help you. Information for a wet patient. When you arrive at the hospital, please tell the receptionist will welcome you, clean your lane, and direct you to the waiting area. The language of your visit will depend on the treatment you're going to have. You may need to have some tests such as an X-ray, which could mean going to another department or you're being referred to other professionals, used as physiotherapy or dietitian. You may need to visit the clinic if the staff of the clinic want to see you again. Another appointment will be around for you. If you need to be admitted to hospital for more treatment, any has an appointment in 4 days surgeon. You will be told when this is likely to happen. If you do not need for entertain, you will be decided to GP card. Exercise Unit 10. Complete the sentence. Look at A opposite to help you. A children, other system, and people with some learning diseases do not have to pay prescription chains in the UK. Patients with mobility problems may be unable to go work. They are housebound. The opening GP appointment is 10 minutes long. A locum is someone who takes the place of a stay number who is unloaded. A carry-out type working hours is known as out of hours treatment. May work combination using a word or phrase from each book. One word can be used in teach, look at A and be opposite to value. Change dressings, make appointments, make home visit, perform minor surgery, refer a patient, run a clinic, supervise staff, take machine. With number of a practice team will be responsible for each of the following. Look at A to value. Running a clinic for pregnant women, midwife. Teaching a patient how to straining is bucket led. The answer is physiotherapist. Lindsay on the GP now that a patient can be. Come to her apartment. The answer is receptionist. Reading and cleaning for people who want to live with him. The answer is practice no. Visitor, a patient who have used return home after a heavy operation. The answer is district nurse. Carving wood at clean UPS on children in a poor neighbor home. The answer is health visitor. Organizing cover for an asthma doctor. The answer is practice manager. Complete the diary for Dr. Stuart Afternoon. Look at A and C opposite to value. 1 and 2 p.m. Practice team meeting other sandwich long. 2 4 p.m. Afternoon surgeon. 11 10 minutes appointment. 4 and 40 20 p.m. Cough break. 4:20 and 5 p.m. Clean with reception for machine. Deal with home visit and refer prescription requests. 5 and 6 p.m. Better work refers to Sunday card admin telephone call to patient, private medical examination. 6 p.m. Phones sandwich to OOA service. Exercise Unit 11. Make their activities to stay of medical education in the UK hidden in a opposite. Designing cadavers. The answer is undergrade. Keeping a law or surgical procedures. Observe and perform. The answer is postgraduate. Working for 4 months in accident and emerging to experience this specialty. The answer is foundation program. Taking a 4-week attainment in obstetrics and gynecology. The answer is undergrad. Taking on one leave course on research development in cardiovascular diseases. The answer is containing professional. Complete the sentence. Look at B and C opposite to value. Just before their final year, students have the chance to take an elective in hospital of herring coins anywhere in the world. Problem-based learning constraint with a problem with age surgeon is 10 specialty. There's the lecture are offering interactive with regular opportunity for the student to ask questions. In clinical attendance, student learning have to train and manage patients. Students select meals can be topic from website medicine use and foreign learning. The section of cadaver is an important part of the anatomy complete. The medical school at the University of Edinburgh is one of the oldest in the UK. She is a consul at the Royal, one of the learning pediatry here, especially in the country. The Royal College of Surgeons is Edinburgh Day from 1505. Make use of their activities to one of the components of the undergrad course describing an A and C opposite. Julie spent 6 weeks working in a small hospital in the East Largest. The answer is oversight elective. A group of students in the school together deposit room of abdominal pain after me and the other 44-year-old man. The answer is problem-based learning. A small group of students takes the pulmonary artery in a cadaver. The answer is dissection. Others explain a move working in the pediatrics world of the local history. The answer is clinical attraction. And learning who to take blood from an elderly patient. The answer is clinical scheme. Do math classes to student travel medicine in this 4 year? The answer is student selective move. Exercise Unit 11. Complete the parts which bear from the book. 2 parts can be completed in different ways. Look at A and B opposite to help you. Demonstrate a competence or harm to something. Supervise to training B. Young Syrian she successfully completes her training. Deliver a course or training program of teaching. Take a course or a training program as a student. Demonstrate progress or complete. Make the 2 parts of the sentence look at A, B, and C opposite to help you. An FGI is a doctor. The answer is D. In the first year of the foundation program. A demonstrator is an anatomical teacher. The answer is H. Who teaching direction. A clinical training is counsel. The answer is F. Who provides training during periods of their clinical care. a supervisor is consul. The answer is B. Responsible for the training program of the training. A medical school is G. Part of a university responsible for medical education. A Lancet is, the answer is C. A period spent as a training in a hospital or the general practice. A college is, the answer is A. A body of specialists are responsible for deriving and answering training in their specialty. A following is a specialist. The answer is I, who has reached the highest level in the their specialty. Why, in full the qualification of the doctor and surgeon look at the opposite to value. Mr. A.H. Jones husband. Bachelor of Medicine, Bachelor of Surgery, below of the Royal College of Surgeons of England, Fellow of the Royal College of Surgeons of India. Dr. Dolly. Bachelor of Medical Science, Doctor of Medical Member of Royal College or Physician. Miss English. Bachelor of Medicine, Bachelor of Surgeon, Fellow of the Royal College of Surgeons. Dr. Mary Waters. Bachelor of Medicine, Doctor of Medicine, below of the Royal College of Physicians. Exercise Unit 14. What kind of reaction murder doctor often? Look at A to help you. A newly qualified Spanish doctor. Provisional registro. A newly qualified Michigan doctor. Limited registration. A doctor who has secondly completed the first foundation year, FGI. Limited registration. An SHO who has successfully completed the foundation program on getting a certificate of completion of training as per several specially registered post a specially registration. Write the abbreviation in word look at A, B, and C opposite to help you. Any doctor who wants to work in the UK must refer with the G and C. The answer is General Medical Council. Some other doctors must pass the plan test before they can register. The answer is Professional and Linguist Assessment Board. Part 2 of the test consists of all was. The answer is Objective Stratum Clinical Examination. In any emergency, remember the ABC protocol. The answer is eyes wide, very thin circulation. Before you can obtain a specimen register, you must have a CCT. The answer is Certificate of Completion of Training. Complete the test, look at A and B and C opposite to help you. My name is Musa and I come from Yemen. I come to the UK about year August after graduating. Because Yemen is outside the IIA. I could only vary million reaction, whereas the GMC at first. It was very different for me too, offering a place on a foundation program. Other thing, I speak good English. I had to take the plan test to join that school work, especially in the UK. If I had to give some advice to other candidates, it would be that consult station. You surgeon seeing memory a set of bashes. It's better to really ideas about what you're surgeon to actor and get the instrument right. After completing major clinical training, I was able to obtain full rejection, but I feel it's different to get an HO. Plus, in the my coaching specialty, pediatrician can hospital now have to demonstrate there is a usable candidate from the IIA. Once I've completed my second foundation's year other certificate of completion of training, which will allow me proceed to a specialist registration with the GNC and import state of the record to becoming a pediatric consult.